right now, in high street clinics across the country, people are paying hundreds, sometimes thousands of pounds to have these unlicensed human-derived cellular messengers injected into their most intimate areas.
Yeah, and the marketing promises this miraculous rejuvenation. I mean, it sounds like the ultimate biological hack.
Mhm.
But the reality, well, according to medical regulators and top surgeons anyway, is that it's a diagnostic and legal minefield.
Welcome to the deep dive. If you're listening to this, you, the learner, are probably tuning in because you want to stay ahead of the curve on wellness trends. You want to know what's next in medical science.
Right.
But I also know you probably hate feeling overwhelmed by aggressive marketing jargon, the kind that makes everything sound like a risk-free miracle cure. So today, we are asking a really tough question. What happens when regenerative medicine outpaces the law?
It's a huge issue.
Yeah.
And today we are looking at the really aggressive shift of a massive medical buzzword, which is exosomes, right into the intimate health space.
And specifically, our mission today is to answer the critical question that these high street clinics often just, bury in the fine print. Who is actually not a good candidate for this treatment?
Exactly.
To figure this out, we are pulling from a massive stack of sources. We've got clinic FAQs, medical journals, investigative reports, evidence submitted to the UK Parliament regarding cosmetic regulations, and the actual guidelines from the FDA and the UK's Medicines and Healthcare Products Regulatory Agency, or the MHRA.
Yeah, so we're going to explore why these microscopic entities are being touted as a cure-all, the reality of how they are being used illegally, and why a very specific subset of people needs to basically run the other way if they're offered this treatment.
Run very fast.
Right. But before we get to who shouldn't get them, we really need to understand the biology of what is actually being sold.
I'm glad you brought that up because, the terminology gets confusing really fast. People hear the word exosomes and they immediately think stem cells. I know my brain goes straight to stem cells.
Which is super common. But they aren't cells at all, not even close.
Wait, really?
Yeah, they are completely acellular, they do not divide, and they do not replicate. So let's start with the physical scale, because it's genuinely hard to conceptualize just how small these things are. Exosomes are nanoscopic extracellular vesicles.
Okay, nanoscopic.
Right, we are talking 30 to 150 nanometers in size.
Oh.
To put that in perspective for you, they're roughly 300 times smaller than your average skin pore.
Oh, wow.
Yeah, think of them as the tiny packets or like envelopes that are released by your cells.
Okay, let's unpack this. So if they aren't cells themselves, they are more like biological FedEx packages.
That is a brilliant way to visualize it.
Yes.
They are intercellular communication vehicles. Inside this microscopic FedEx package is a payload, like a blueprint.
Oh, okay.
They carry proteins, lipids, RNA, and DNA fragments. And they travel from a parent cell to a target cell, drop off this payload, and deliver very specific instructions.
Instructions like, calm this inflammation down, or produce more collagen here, or repair this damaged tissue.
Precisely. In a healthy body, they are constantly coordinating wound healing and maintaining tissue barriers. Because of this, the regenerative potential is genuinely thrilling. But here is the first major source problem we encountered in the data. Not all exosomes are created equal.
Right, the source material dictates everything.
Exactly. When a consumer sees the word exosomes on a clinic menu, they rarely know what they are actually buying.
Because the sources show they generally come from three places, right? Plants, animals, or humans.
Yeah.
And I noticed the plant-derived ones, like those from Sika or Panax ginseng, are heavily marketed right now.
They are, yeah.
I assume that's because those specific plants are already known in skincare for their soothing, anti-inflammatory properties.
That's a really big part of it. Plant-derived exosomes offer ethical, sustainable benefits. They carry a much lower risk of immune reactions, making them highly biocompatible, especially for sensitive skin.
Okay, that makes sense.
But, and this is the catch, their biological signaling might not perfectly match human cellular needs. And Apple's repair instructions aren't identical to a human's.
Right, the FedEx package is in a different language.
Exactly. Then you have animal-derived exosomes. These offer better biological compatibility with our cells, but they require incredibly complex purification processes to strip away anything that might cause an allergic reaction.
And then we get to the really controversial one. Human-derived exosomes. Theoretically, these should be the best, right? Because they speak our exact biological language.
Theoretically, yes. But they pose massive safety questions regarding contamination, severe immune responses, and pathogen transmission. We're talking about biological material taken from another human being.
Yeah, I was reading the data on cancer therapeutics research regarding this, and I noticed a huge bottleneck. Getting these microscopic FedEx packages out of a human cell and into a vial isn't just difficult, it's incredibly destructive.
I'm glad you brought up the lab mechanics,
Yeah.
because it's brutal.
The research mentioned extraction processes like ultracentrifugation and size exclusion chromatography.
Right, so ultracentrifugation involves spinning the cellular material at hundreds of thousands of times the force of gravity just to separate the components.
Hundreds of thousands of times.
Yeah, and then size exclusion chromatography is essentially forcing the material through a microscopic sieve.
So if we go back to the FedEx analogy, you are basically taking these delicate little packages and throwing them into an industrial blender or shoving them through a cheese grater. The instructions inside are going to get ripped up.
That is exactly what happens. The research explicitly states that, to date, no method has been developed that can yield clinical-grade exosomes economically and reproducibly.
Wow.
The process alters the exosome populations, they get crushed, they clump together, or they just lose their payload entirely, which is a staggering reality check when you consider that clinics are selling these treatments for hundreds of pounds a session, promising clinical perfection.
Yeah, and because these packages are so theoretically powerful, aesthetic clinics haven't stopped at face serums or hair loss treatments. The sources show this really aggressive shift toward pushing exosomes as a premium, top-tier treatment for intimate health.
They really are. Clinics are marketing these intimate exosome therapies as a newer, better alternative to PRP.
Let's define PRP quickly for the learner. That's platelet-rich plasma. That is a treatment where a doctor draws your own blood, spins it in a centrifuge to isolate the growth factors, and injects it back into you.
Exactly.
But now clinics are saying, hey, skip the blood draw, use our bottled exosomes instead. They are specifically targeting conditions like female sexual arousal disorder, or FSAD, and decreased clitoral sensitivity.
What's fascinating and deeply concerning here is the use of what I call winner language. The clinical FAQs we reviewed, particularly from specialist women's health clinics, stress that claiming exosomes are universally better than PRP ignores clinical reality completely.
Because it treats the symptom like a simple mechanical failure, like a rusty hinge that just needs some regenerative oil squirted on it.
That is the perfect analogy for the problem. Intimate health symptoms are wildly multifactorial. Conditions like female sexual arousal disorder or a loss of clitoral sensitivity aren't just about local tissue quality.
Right.
They involve complex nerve health, blood flow dynamics, systemic hormonal balances, medication side effects, pelvic floor muscle tone, mood, and psychological context.
So if someone is experiencing a sudden loss of sensitivity because their pelvic floor is in a severe spasm, an exosome isn't going to fix that.
Not at all.
Or what about underlying dermatological conditions? The sources mention lichen sclerosis. For anyone unfamiliar, that's an autoimmune condition that causes thin, white patches of skin, often in the genital area. You can't fix an autoimmune attack with a generic growth messenger.
You absolutely cannot.
Yeah.
If your immune system is actively attacking the tissue, sending in a messenger telling the tissue to grow doesn't stop the attack. It might even exacerbate the inflammation.
Oh, wow. So it could make it worse.
Yes. This superior marketing pushes patients toward buying a product off a menu rather than getting a proper medical diagnosis. You cannot inject away a symptom if the root cause is a systemic hormonal drop or an active infection. The treatment label is not the diagnosis.
Right. And if you're listening to this and thinking, okay, but what if I just want to try it anyway? What's the harm? Well, this is where we get to the core focus of our deep dive. Because these cellular messengers are so potent, sending them into a body that is already dealing with a serious underlying issue is a recipe for disaster.
It really is.
There is a very strict checklist of people who should not even be allowed in the treatment chair.
So let's walk through the absolute contraindications. We will start with the specific intimate red flags.
Okay, let's hear them.
You are not a candidate, and you should immediately pause and seek a proper medical review.
All right.
If you have unexplained bleeding, any symptoms of an active infection, vulval lesions, or severe unexplained pelvic pain.
So if you have any of those, your priority is pathology, not regeneration. You need to know why you are bleeding or in pain. If you have an active bacterial infection, what does an exosome do? Does it accidentally help the bacteria?
It's highly possible. Exosomes carry instructions to build blood supply and increase cellular activity. If you increase blood flow and nutrient delivery to an area currently overrun by an infection, you are potentially feeding the infection.
Yikes. That brings us to the systemic contraindications. The sources state you are definitively not a candidate if you are pregnant or breastfeeding. I imagine that's because there is simply zero safety data established.
Zero data, none. We are talking about introducing billions of external biological signaling vesicles into a body that is currently orchestrating the most complex developmental process possible.
Growing a fetus.
Right. We have absolutely no idea if those external signals could cross the placenta or enter breast milk, or how they might interact with fetal development.
Better safe than sorry. The sources also list blood clotting or coagulation disorders as a major disqualifier. I want to unpack the mechanism there. Why would an exosome be bad for someone with a blood clotting issue?
It comes down to angiogenesis, which is the formation of new blood vessels. Exosomes are phenomenal at promoting angiogenesis. Furthermore, many exosomes naturally carry tissue factor on their surface.
And what does tissue factor do?
It's a protein that basically initiates the blood coagulation cascade. So if a patient has a history of deep vein thrombosis or a hypercoagulation disorder, introducing millions of messengers that tell the blood to clot and build new vessels is essentially throwing a match into a powder keg.
Okay, that makes terrifying sense. Now, I want to look at another major contraindication from the sources and challenge this a bit. If exosomes are just natural healing messengers telling the body to repair itself, why are they strictly contraindicated for patients with active malignancies or a history of cancer?
That question goes right to the heart of how exosomes function. Remember the FedEx package analogy?
Yeah.
Exosomes carry instructions that essentially say, regenerate, multiply, build a blood supply. In a healthy body, that repairs a wound. But what happens if you deliver that exact same message to an area where cancer cells are present?
Oh, wow. You're handing the blueprint for growth directly to a tumor.
That is the grim reality of it. The exosome has no moral compass. Cancer is, at its core, uncontrolled cellular division. The exosome doesn't judge the cell it's talking to, it just delivers the message to grow.
That is so dangerous.
Right. And while there is no direct clinical evidence proving that aesthetic exosome treatments have caused cancer, the theoretical risk is massive. The regenerative principles of exosomes could stimulate the wrong kinds of cells, promoting that angiogenesis we just talked about, effectively building new blood vessels to feed a tumor.
Which is why anyone with an active malignancy or undergoing cancer treatment must absolutely avoid this therapy.
Unquestionably.
Okay, so let's say you, the learner, are listening to all this and mentally checking the boxes. You don't have cancer, you aren't pregnant, you don't have a blood clotting disorder, and you don't have unexplained pain or infections.
Right, a clean bill of health.
You might be thinking, great, I'm a perfect candidate. Well, you still might not be. And this isn't because of your biology, but because the treatment being offered to you might be entirely illegal.
Yeah, the regulatory reality outlined in the sources is just staggering. Both the FDA in the United States and the MHRA in the UK have 0 approved exosome products for cosmetic dermatology use.
Let me repeat that for the listener because it's wild. 0 approved products for cosmetic injection.
0. The distinction between topical application and injection is the absolute legal boundary here. Under UK law, and similarly managed by the FDA, injected exosomes are classified as medicinal products. They are biologicals.
Meaning they're highly regulated.
Exactly. It is strictly prohibited to inject them for aesthetic purposes. They can only be applied topically.
So usually that means applying them as a serum after something like microneedling, right? Where the needles create tiny superficial channels in the top layer of the skin for the serum to absorb into, without actually injecting a bolus of fluid deep into the tissue.
Correct. But the investigative reports in our sources show that clinics are just blatantly ignoring this legal boundary. Despite the law, an investigation found that roughly 1 in 5 high street clinics in the UK were actively using illegal injected exosome products.
1 in 5.
Yeah. And it gets worse. They were deriving them from human umbilical cord blood or liposuction fat.
Wait, if you're listening and wondering if it's illegal, how are these high street clinics getting their hands on human umbilical cord blood? Because that sounds highly restricted.
It's a massive regulatory loophole. Regulated suppliers and pharmacies operate with strict transparency. They won't sell injectable biologicals to a beauty salon.
Right.
But unregulated third-party distributors supply these unlicensed products directly to practitioners who might have only taken like a 1 or 2 day training course.
Unbelievable. And they mask what they're doing with incredibly vague, soothing terminology. You know, you won't see unlicensed human umbilical extract on the spa menu. You see phrases like proprietary regenerative blend or advanced growth factor mix.
Which should be a massive red flag for any consumer. If a clinic hides behind those phrases, they are likely operating outside legal parameters. Furthermore, by injecting an unlicensed biological product, the practitioner is likely voiding their own liability insurance.
So if something goes wrong, the patient has absolutely zero financial or medical protection.
Nothing. And things absolutely can go wrong. The sources cite an NBC News analysis highlighting severe potential complications from these professional injections. We're talking scarring, deep tissue infections, and severe inflammatory reactions.
Yeah, and one source noted independent testing of products marketed as exosomes. They found that 95% of them didn't even meet the basic structural definition of a functional exosome.
95%. Let that sink in.
They were either broken from those harsh extraction processes we talked about, the cheese grater, or worse, they were contaminated with endotoxins.
I want to clarify what endotoxins are because the word sounds scary, and, well, it should be.
Please do.
Endotoxins aren't live bacteria. There are toxic fragments from the outer membrane of certain dead bacteria. If they get into a product, your immune system recognizes them and initiates a massive inflammatory response.
Which is the last thing you want.
Exactly. Injecting endotoxins into highly vascular, sensitive, intimate areas can lead to severe swelling, pain, or even localized shock.
So we have this incredible biological mechanism, but a market that is utterly saturated with unregulated, broken, and sometimes dangerous products. You know, I was looking at the data from BAPRAS.
The Plastic Surgeons Association.
Yes, the British Association of Plastic, Reconstructive, and Aesthetic Surgeons. They conducted a priority-setting study using a modified Delphi process. I actually had to look up what a Delphi process is. It's basically just a highly structured method for gathering expert consensus through multiple rounds of questioning.
All right.
And the results of the study shocked me.
The BAPRAS study is incredibly telling. They surveyed 66 top plastic surgery consultants to rank their top research priorities on a scale of 1 to 100. What came in at number 1 with a score of 74? High-quality trials, specifically randomized controlled trials, and systematic reviews.
They want the actual science.
Yes. Number 2, with a score of 66, was outcome assessments.
The top surgeons in the country aren't demanding more access to exosomes. They are demanding actual data. The medical community is begging for high-quality, long-term clinical trials to prove safety and efficacy before fully embracing these trends.
They see the potential, definitely. In that exact same survey, tissue engineering and biomaterials rank 3rd. So the interest in regenerative medicine is absolutely there at the highest levels of surgery.
Right.
But the medical establishment demands proof of safety and standardization. Meanwhile, the high-street aesthetic clinics are completely jumping the gun, selling the theoretical promise as a guaranteed risk-free cure today.
So, to bring this all together for you, the learner, we started this deep dive looking for the truth about exosomes in intimate health. What we found is that while exosomes themselves are incredible biological messengers with massive future potential, the market right now is a minefield of unproven claims and illegal practices.
If you take nothing else away from this, remember the contraindications. If you have unexplained intimate symptoms, active infections, severe pelvic pain, a history of cancer, blood clotting disorders, or if you are pregnant, you are absolutely not a candidate for this treatment.
Period. Your first step must always be medical pathology, not cosmetic regeneration.
Exactly. And if you don't fall into those categories and are still curious, you have to be your own fiercely protective advocate. The smartest thing you can do is demand a medical diagnosis from a qualified doctor before you ever agree to a treatment.
Ask the hard questions.
Yes, when you are evaluating a clinic, ask for the full brand name of the product. Check if the product has CE marking.
And just to clarify for the listener, CE marking consists of those little letters C and E you see on products. It means the manufacturer claims the product meets European health, safety, and environmental protection standards. It's a baseline level of accountability.
Exactly. You also need to ask if the product is plant, animal, or human-derived.
And the ultimate deal breaker. If a clinic offers to inject exosomes into you, especially human-derived ones, walk away. They are operating outside the law, they are likely voiding their insurance, and they are putting your health at a massive risk.
True exosome treatments in the cosmetic space at this point in time should only ever be applied topically. The science of cellular communication is breathtaking, but science takes time to standardize. Right now, the marketing is moving much, much faster than the safety data.
Which leaves us with a final thought to ponder. We spend so much time searching for an external fix. Right now, the aesthetic industry is trying to sell us a magic, highly priced vial to fix the complex realities of aging and intimate health. But our bodies are already right this very second, constantly communicating via these nanoscopic exosomes.
Billions of messages are being sent and received as you listen to this. It is an internal pharmacy that never closes.
So, as medical science finally catches up to the hype, might the ultimate exosome therapy of the future not come from a vastly expensive, potentially illegal syringe, but rather from learning how to precisely trigger our own cells to produce and release these exact healing messengers on demand? The true precision might not be in the product we buy, but in unlocking the code our bodies already use.